So good afternoon, everyone. So I know very difficult time, but yes, I'll try to make it more interactive. And the topic for this panel discussion is the business of health and wellness, scaling impact across the world. So the business of health and wellness today is at the intersection of purpose and scale as demand goes globally. The challenge is not just innovation, but building sustainable models that deliver measurable impact across diverse populations and geographies. The global health and wellness ecosystem is expanding rapidly and it is driven by technology, policy, and also the behavioral mindset of the customers and the clients. The real question is how do we scale impact responsibly while balancing the outcomes, balance sheet, equity, as well as commercial sustainability? That's a very important question which we face in the healthcare. So now, to start with, I'll put the first question to Dr. Vasundhara because running a hospital itself involves a complex operation and it has a high patient expectation. We call it as a patient-centric hospitals, and nowadays hospital is nothing but a five-star hotel along with a lot many surgeries and OT complexes. So how the Manipal Hospital successfully scaled across multiple locations while maintaining the quality of care? That's the first question to Dr. Vasundhara.
So very good afternoon. At Manipal Hospitals, we have a simple belief that scale also applies to amplifying quality. It does not mean weakening quality. The whole idea is to have portable reliability because at the end of the day, that is what patients expect from us. That is what the families expect from us. This is primarily done by ensuring that we stay patient-centric. We have got standardized protocols, operating processes, focused on patient safety, safety bundles. Having said that, we also have common dashboards because anything that you do has to be measurable. And unless we measure ourselves in a similar fashion across all our units, across all our hospitals, the patients will not have the same experience wherever they walk in. And that is the intention.
Thank you, Dr. Vasundhara. So that's where we talk about the hospitals where the people come from an illness. But there is a shift which has already happened and which is from shifting from illness to wellness. So now my first question to Anushri is now, the shift from illness to wellness is significant. And what was the thinking behind establishing Swastik Wellness? How does this idea came to your mind?
Happy afternoon. Thank you for the question, Nidhi. I'll just bring perspective, to the audience out here that until now we've always looked at healthcare or, the entire global industry of healthcare was always reactive. It's always been pathology centered. We're slowly shifting and I think COVID was a big eye-opener to all of us where we shifted from being reactive to, proactive to life and taking care of life. I think there were 3 gaps that we identified while structuring Swastik. I would put it as A is the prevention gap. So initially everybody went for things that when a symptom came up, it's already too late to do something or you're already in a space where, something has gone wrong. So the prevention gap was a science that we have had for over thousands of years in the name of Ayurveda, naturopathy, yoga, physiotherapy. And we brought that along with modern biology markers, that is modern diagnostics. We've bridged that gap of, where ancient science could be combined with modern biology. So the fragmentation gap was one of the gaps that we wanted to fulfill. The second was in the wellness space, particularly, was the fragmentation gap. So you have some centers where we saw diagnostics was happening, we saw somewhere nutrition is being given importance, somewhere there's Ayurveda. Somehow there wasn't one space that holistically covered the physical, emotional, and mental behavior or conditioning or healing at one space. So we were one platform that could stitch all of these together, from modern diagnostic, Ayurveda, breathwork, nutrition that meets your physiology, cognitive healing, energy healing, counseling in one area, not just fragmented but as one systematic designed protocol. Another thing was a lot of spaces, I call it the design gap. So a lot of hotels have now converted itself into a spa center and they call themselves wellness, they introduce yoga. However, I think there has to be intention behind architecture. So we've built an ecosystem that supports your biology, not just something that would look pretty as far as infrastructure. So I think the design has to support healing. And we've had this forever, you know, the pyramids, a temple, the caves, the mountains, they were chosen as spaces to go back and heal because they were designed in a particular way. So we've brought all this geometry into our infrastructure and gapped where a space is intentionally built to heal you. I think that was bridging these three gaps. We brought together Swastik with an intention to stitch ancient wisdom with modern science and with measurable outcomes. Thank you so much.
Thank you, Anushri. I think I'll take from, going from reactive to proactive and fragmentation. So even though the Swastik is trying to answer the fragmentation in a physical way, we have here Anupa, who is heading the Aditya Birla Wellness. So I would really like, Anupa, you to put focus on what you are going to break this fragmentation as with the Aditya Birla, and also from your perspective, how is the wellness industry, functionally different from hospitals in terms of approaching the customers or the clients?
Sure, thanks. Just a little perspective about my career. I have about 3 decades of experience in healthcare. My first 12 years of my career was in the pharma industry, and the balance, whatever left, has been more in insurance, wellness, and healthcare. The reason I stated that is because when I was in the pharma industry, it was all, and I was looking at the chronic disease portfolio. So we launched a lot of antihypertensives, cholesterols, anti-diabetics. If you all know Trica, it's alprazolam, anti-anxiety drug, etc. So these were actually some of the brands that I personally managed, and and the whole approach was curative, right? Which is what typically we see, the approach with hospitals. It's more of episodes of care, at the time of critical, instances or incidences. And, as you said, it's obviously a very reactive approach versus a proactive. I'm sure a lot of that hospitals are also changing and, trying to bring in. Today also, if you go to some of the leading doctors' clinics, you will see a dietitian sitting there. You might see a mental counselor sitting in another room. And they are also adding, holistic value to the entire treatment, etc. So definitely there is a shift, but yet it is completely, I would say, wellness is more for preventing you from getting hospitalizations, to get hospitalized, and thereby, even at Aditya Birla Wellness, we use it as a strategic lever to actually reduce claim cost, reduce hospitalization, right? So that's an impact matrix we measure throughout. One of the examples I would like to give, in my earlier companies, we had launched this pregnancy care program with the intention of reducing the C-sections, which we typically saw about 70% of our claims was coming in from C-sections and complications. And the purpose was, now how do we improve natural childbirths, right? So the entire antenatal care program that we launched, a 9 months program, and actually even prior to pregnancy also we had touch points there, was to reduce the C-section. So it was taking care of the entire needs of a woman during the pregnancy, in terms of, firstly, the myths, etc., that women have around that period. Secondly, in terms of giving them support and tools to think about say for example, how do you reduce pain during labor pain, etc., etc. And thirdly, mainly around your lifestyle, your diet, nutrition, your supplements that you're advised, the tests that you need to do, the triple marker, double marker, that can prevent a lot of things that would have been unknown otherwise, right? So the way we kind of track that, we could actually bring that reduction from 70% to 56% in that cohort of the population that we were looking at. Where I'm coming from is, while similar programs were also launched by, say, I think Fortis, LAFEM, and few others. I think Cradle was Apollo's initiative. I'm talking about the level of, measurement and, the impact and outcomes that we were trying to measure with our program, because it was more on the wellness initiative side, right? So coming back to the fact that while, hospitals are there, of course, on the curative side, but on the preventive side, the way wellness companies would, without any filters, kind of track these outcomes. It's very detailed. The other thing is in terms of the entire trust. So when we were offering a lot of on-site health camps or clinics to a lot of our clients, there was always an apprehension to use a hospital, because you don't know why would you be maybe steered to a certain doctor or a specialist or a provider. So that's where I think, the whole thing of trust comes in from a company which is not having any underlying intention on a revenue line or a business, So yeah, there are definitely clear-cut demarcations. Now, of course, with the Aabha ID, etc., we're also digitizing a lot of the data on the hospital side. But on the wellness side, we've been doing that for a long time. And that starts with a lot of baseline data on your health checks, your biometrics, which is the core for, where you're really looking at knowing your health numbers and, bringing in an impact in reducing those risks to ensure that we do not land up with red or high-risk population to increased diseases and hospitalizations.
Yeah, thank you. Very interesting perspective here, Anupa. Nobody would have thought about, wellness can bring down. I mean, we have thought about this, but the evidence is there with Aditya Birla. How can the claim cost can be brought down with the bringing the concept of wellness. That is one, and also how it can help us to underwrite the risk, medical risk component in that. Really interesting. So my next question is to Ritu. There are many sites or which, addresses the fragmentation, and they bring the service providers and end users at one platform and connect them. But, what was the core idea or a gap that led in the foundation of your Connected Minds?
ओके, थैंक यू निधि. सभी को नमस्कार. मेरा नाम ऋतु भारद्वाज है और आई एम सिटिंग हियर टुडे नॉट एज अ प्रोफेशनल और अ फाउंडर ऑफ अ कंपनी. आई एम सिटिंग हियर टुडे एज अ मेंटल हेल्थ सर्वाइवर. सो आई एम टॉकिंग अबाउट द हेल्थ बिजनेस फ्रॉम अ यूज़र पर्सपेक्टिव. मैं उस फेज़ में गई आज से 7-8 साल पहले, एंड आई वॉज अ जर्नलिस्ट फ्रॉम लास्ट मोर देन 20 years, एंड आई वॉज जस्ट थिंकिंग आई एम सो अवेयर, आई एम सो इंटेलिजेंट पर्सन, आई नो एवरीथिंग. But when it comes to my own mental health, कुछ नहीं पता था, कुछ भी नहीं पता था. और this is the gap that leads to the foundation of Connected. First awareness, then the right vocabulary, and then the genuine and the professional help. So that's why I just founded Connected. So Connected enables professionals to come on board and refer within the ecosystem. So Riddhi is also part of Connected. I can proudly say we have a very good team of mental health professionals, certified professionals. Our first priority is the certified professionals. Because in today's time, anyone who is visible on social media, who is creating content around the positivity and the motivation, we consider them as the mental health professionals. And this is wrong. This is the biggest challenge we will face in the mental health field. If you want to make any change in the mental health field, हमें इसको change करना पड़ेगा. And यही है कि बहुत ज़रूरी है कि सभी professionals genuine help जो है वो लोगों को मिले. And we are using technology as an enabler, not as the replacement. So Connected is just about connecting the dots. So as a user, I always think, where are the people who are sitting at different areas of country and the world who are saying that they are working for mental health of people. So I'm just trying to bring them together on my platform and to make mental health accessible for everyone.
Thank you, Ritu. I mean, this is very important when you create a, any platform that has to be created with the mindset of the people who are going to use and with her or his experiences. Obviously, the wellness we talk about includes the mental wellness also, but wellness as a concept is, it's always conceptual thing. So my question, Riddhi, to you is, what are some innovative ways to make wellness actionable and experiential, especially for children and families?
Thank you so much. And I guess among all the adults here talking about data and AI and a lot of things, I think I'm the only one here who talks about children. So I'm going to talk about from the perspective of a child. Me being a child psychologist, I believe that wellness is doing something rather than listening to something, or, it's more actionable. As simple as to all the audience or all the people who are sitting here, all the experts have been speaking right from the morning. If I say shake off, okay, how would you perceive? How would you perceive the word shake off? Yes, right? And everybody would have a different meaning to it, okay? The word shake off. But when I say that, okay, now follow me, mirror me, and if I say that, raise your right hand, can we all raise our right hand, please? Our right hand? Okay, now shake. Go on, shake, shake, shake. And your left, and your head. So now, thank you so much. So now there's a synchronization among whatever we're doing, right? Wellness is something which is escalated, I believe. Okay, if parents are aware, parents are mindful, children are aware, children are healthy, emotionally and mentally. Being a child psychologist, we just spoke. When I launched Emotion is an idea which is created, a space which is created in hospitals, colleges, schools, play parks, and what we do is we create different segments within that space where a child, a corporate executive, a parent, whoever it is, can just pass through all the things, the processes that has been laid in that space. They can experience it and they can understand how are they feeling. Being 20 years into this field, what I've noticed is the major issues that is happening with children, with young adults, parents also, is they having less vocabulary of emotions. A child who is not able to speak about how the child is feeling, the communication is not there. And when the communication is not there, the parent's understanding is only through their exposure, not what the child is experiencing. All right. So it's very important to make it actionable. It's very important to do things which is not online but absolute offline, where children are experiencing it, where children are understanding it, where children have questions and they talk about it. All right. So when I did Emotion, people were asking me that, and the first center I have started at Kidzania, which is India's biggest, indoor park. And everybody started telling me this will not, you will not be able to scale up, or you will not be able to take it to places, make it online. And the very first time I launched it, I was very sure I don't want to make it online. Because emotions are something which I want children to feel it, experience it, understand it. All right. So in that space, it's all about, there is center cap, there is a mirror cap. A child is going and just giving a tight hug to self. They're experiencing. When a child experiences, the child understands what is wellness, my mental health, my emotional health, and then comes the physical health.
Thank you, Riddhi. I mean, I'm glad we could really experience what is that. So I know whether it's health or illness, whether it's a wellness or whether it's a mental wellness, all come with the perspective of it has to be sustainable. And when we talk about sustainable, there has a matrix of being financially sustainable. So running a hospital and making it, really sustainable, a single hospital is difficult. Whereas Manipal Hospital has really done a, wonderful job. They've been having, I think, more than 45 hospitals across India. 49. So to be precise, it's 49 hospitals. So, Dr. Vasundhara, question to you is, what was the strategic motivation behind expanding Manipal hospitals to various geographies and make it financially sustainable?
I think primarily it is purpose driven. Think about ourselves today. We want groceries delivered at home. We want everything that we need to come to us rather than us having to go to it. And the same thing happens with healthcare. Whether it is the primary, the tier 2, tier 3s that we have, people are now looking for advanced healthcare, tertiary healthcare to be available, easily accessible to them. So primarily the effort has been to take tertiary healthcare to the populations that really require it. And a large country like India, I think there are a lot of spaces that we are still missing, a lot of cities, a lot of smaller places that we are still missing. Also, what happens with scaling is that you have economies of scale. You can actually invest more into good talent, into technology, as well as into training. And today's requirement is definitely sustainability and accessibility.
Thank you. The very relevant points, it is about the technology, people, and also the capacity building. Thank you for putting that forward. But from Dr. Vasundhara, I'll go to Anushri, because you talk about fragmentation and then also comes the, financial sustainability. So my question to you is, since wellness is considered as an optional as compared to illness, where it is mandatory for you to go, how have you ensured the financial and operational sustainability of the Swastik well-being?
Very interesting and actually very relevant. It's the most relevant question that we get often asked. To bring perspective, I don't know if everybody is aware, but Swastik Wellbeing Sanctuary has just launched in November 2024. So we are a relatively new organization here. It is bridging gap between, like I mentioned earlier, between ancient wisdom and modern science in a luxury, biologically created environment, which provides the masters to bring their science forth. Now, how do we make this financially sustainable? How do we sort of scale this up is a big question, especially in an industry which is newborn. It's not an industry that has been there forever. So talent is not amply available, and genuine talent, like, she mentioned earlier that you have a lot of, for example, I'll say yoga. It's a very overused word today. But once we got into the industry, we realized finding an actual authentic yoga master is actually very difficult. While all of us can probably name a few in our locality, but how many have understood the biology of our body? Yoga is such a subtle science that every movement can actually affect you, and it can be so impactful that it can cure diseases. But who has done, you have 3-month training and people become yoga teachers. So we, at this point of time, there are several ways that we are trying to be financially viable at this point of time. The first is a multi-revenue generation model. So we are an adaptive center. That means that even though we are for long stayers or for people who have to come to us because we're still in a curative era, people have still not completely shifted to preventive. I think that is a longer span. There are enough people who are looking for cellular health and longevity, but we still have majority, I would say over 50% of our audience who are now coming for treatments that are still curative. That means they've gone through lifestyle disorders and they're coming to us. What we've also realized is that problems are not happening overnight. We've heard enough that, there was this really healthy guy in your office and he suddenly collapsed at the age of 40. It's not unheard of anymore. Why is it? He ate right, he worked out right, but his cortisol levels had spiked up like they went unnoticed. Your insulin picks up, you have gut imbalances, and nobody talks of these things. You can talk of a cancer, you can talk of thyroid, you can talk of TB, but who talks of a gut imbalance? And these are triggers that eventually where people go back and collapse. And they collapse in a moment, but this is not something that has happened overnight. Your body has signaled you enough before it collapses. So we have curative programs which do help people to come for 7 nights, 14 nights, where they are coming for certain programs. But how do also people access to us? We also open up for wellness weekends, vacations, where people come and get an insight to us, understanding what are we all about, come understand the science before investing into it. So that's one model. We also do a lot of corporate tie-ups where people come. There is a lot of burnout happening on the boardroom table. So they come in here, they have effective meetings as well as programs that can support their leadership roles. We also do a lot of hand-holding to such professionals. So that's a big part of our program. Another is, I think, women going through transitional phases. So, there are a lot of people who have not been actually already addressed as groups that need to be. So we create special retreats, programs, we collaborate with masters. So I'm not just a resort where there's hotel occupancy or room occupancy, but we have several programs and retreats which one can access, and they eventually also turn out to be different economic models for us. That's primary A. Second is also optimization of resources at this point of time. So we have healers and masters that also multifunction. So for example, our yoga master is also trained under sound therapy. They go through rigorous training. We employed our people almost 2 years before we actually launched. So that's the kind of training that everybody has gone through, and they've gone through training under the scientists. They've not just gone through a diploma, but they've gone to those respective centers, been certified, been trained enough, and then are actually meeting our seekers. So people are being optimized in multiple roles. That's another way to optimize resources on site. And eventually the vision is to scale. So it is to have multiple centers and spaces globally where Swastik philosophy can reach out to the world. It could be in ways of collaborating, it could be in partnerships, or creating our own setups.
Thank you.
Thank you.
I think that really makes, answer to us how we can bring a sustainability. One of the ways scaling it up, bringing more numbers and optimizing the resources and making them multi-skilling. Again, coming to purpose-driven was also one key finding. From there, I'll come to Anupa, you, because as she was saying, we have to scale. So what are the key operational challenges you face in scaling the wellness industry?
Yeah, so I think firstly, the reach, so when we want to reach out to more and more number of people, more and more number of individuals to, maybe do basic things like your health checks, reach out for some advice. It could be multiple things. So let me just talk about health check first to start with. So firstly, 60 to 70% of our population is actually out of metros, right? And our reach on diagnostic centers, etc. I mean, we know the top ones being, obviously the metros, but we have a decent spread now. And that's how we service a lot of our pre-policy, health checkups also for, Aditya Birla Health Insurance business, etc. So one is tying up with the centers. The second thing is the centers that we have, while they do have accreditations like NABL or CAPP. I'm looking at you because I think, the way the hospitals are graded or regulated, I don't know whether we have that kind of rigor on the diagnostic center side, which is, at least not too much of an understanding from that point of view in terms of the quality. So it's a little fragmented, that entire segment. The second thing is from a point of view of digital and tech. Right, so if again an example like when we were trying to do health checkups, we realized that's the first data point we need. Okay, if we really want to show an impact for any intervention, any behavioral change, lifestyle, etc. Now, how do we get that data when there is a little resistance for employees or individuals to go and do the health checks? So we introduced this whole thing called as digital health assessment. I don't know how many of you all have heard of this. With a single finger scan on your phone with less than 1 minute with that particular tool, product of course, which we have at Aditya Birla Wellness and Health, we are able to in less than a minute give you a screenshot of your health. again, the reliability, etc., would be about 92%. Yet, it's a good initial first screening tool, given the resistance to go and do your blood work, etc. So, I think that's something that we were able to crack down there. I think the third thing is in terms of the ratio of people versus the doctors, right? It's almost, I was just reading, there are different numbers showing, but it's around 1:850 or 1:1500 in some recent reports I was reading, right? In terms of your doctors that, we can access. Now, what happens is, your wait time at clinics on an average is 2 hours. Your per consultation on an average is about 2 minutes in India. Okay, so just look at the level of care, the level of personalization that's happening, right? So again, to solve for that, I think, and a lot of it, even COVID solved, was the whole telemedicine piece, right? It was accepted as a way to consult, video, telemedicine, etc. And employees, people were ready to adopt digital mobile phones, etc., to kind of do those consultations. So completely seamless journey. You select your doctor, through the mobile app. You select your date and time of appointment. You do the consultation. You get a prescription. Your results, your reports get digitized. You can even kind of track it from your last time's reports versus this time's. That then enters into the bucket of the pharmacy, where again the entire journey is online. So it's, for us at least, it's a seamless end-to-end preventive journey, and where people can just access healthcare anytime, anywhere. And I think the whole purpose being that, how do you really improve engagement? Because I think one of you were talking about instant, everything you need at home, instant gratification. That's how the Gen Z is, right? So how do you really create rewards and incentives to reward healthy behavior so that people really adopt to this? And we are able to take that adoption to almost 60 to 70% with all the number of people that we've targeted our product on. We see almost a 60 to 70% adoption, which is good. So there were challenges, but I think, as we speak, we are dealing with it. And I think one of the main challenges, I just remembered, is on monetization. So while we are a wellness company, it's tough to monetize prevention, right? Because if you have a problem, you will go to a doctor, you will go to a hospital, and you will get treated. But if I just, you look healthy, if I tell you, why don't you do this health check, or why don't you take this example, a pre-diabetes care program, or a prevention program, or a weight management program, or whatever it may be, you would say, oh, I don't think I need it, right? So I think the whole, really driving that relevance and conceptually selling that one, and then monetizing it is one of the biggest challenges that I've dealt, with in a lot of years. I see it changing, but yeah, long way to go.
Yeah, that's a very interesting point, incentivizing the one's wellness. So now we, think about, if we say that you have gone through this wellness, you will get some discount on your premium, so on your health insurance. That would be really nice way to bring this concept. But yeah, and one more thing, which she spoke about is telemedicine, adoption of digital health to make it scalable. And this is quite happening in the terms of when we talk about the physical wellness. Now my question to Ritu, to you, is how do you leverage technology to make mental wellness solutions scalable across different locations the way it is happening in the physical wellness?
Okay. So at Connected, our first and foremost priority is to human connections. Humans crave for humans, and humans are medicines for humans. We totally believe that. But technology, we definitely use that just to amplify the accessibility and the easy work for the professionals. And time is the biggest thing in mental health, or maybe in the health or wellness area. So our tech, or our website, or our app, or our supportive systems, they help the professional and the people to get this support at the right time, and to basically make it easier and sooner for them. We usually do digital workshops, we do seminars, one-on-one therapy is there, but yes, you can't deny everyone don't need one-on-one therapy. And when we are talking about the preventive or the wellness thing, the basically communities, the workshops, the seminars, the awareness sessions, we do use AI and tech for that. As I said कि मेरे पास कोई vocabulary ही नहीं थी. कैसे बताएंगे हम? आज की जेनजी, वो पीछे स्टूडेंट्स बैठे हैं, उनके पास फिर भी है गैस लाइटिंग, डिप्रेशन, एंग्जाइटी, बर्नआउट और पता नहीं कितने हैं, है ना? हम लोग अब तो फिर भी बोलते हैं हमें तो मेंटल हेल्थ ब्रेक चाहिए, आई कांट कम टू ऑफिस एज आई एम नॉट फीलिंग गुड टुडे, बट हमारे पास नहीं थी। हम तो ये भी नहीं कह पाए कि मेरे पास डिप्रेशन है, स्टिल आई एम नॉट डायग्नोज्ड विद एनीथिंग, क्योंकि उस समय मेरे पास कोई सपोर्ट ही नहीं था। मैं नहीं कह सकती मैं डिप्रेशन में थी या किस में थी। और यही सबसे बड़ी बात है कि जब तक मैं क्लिनिकली डायग्नोज्ड नहीं हुई हूँ तो मैं ये नहीं कह सकती कि मैं डिप्रेशन में थी। एंड दिस इज़ द मैसेज वी वांट टू गिव। सो कनेक्टेड इज़ बेसिकली यूजिंग टेक्नोलॉजी to make maximum use, to save time, to get the help like sooner to the people, and to make it easy for the professionals who are struggling really hard. अच्छे professionals visible ही नहीं हैं। हम कह रहे हैं, WHO ने अभी डाटा दिया कि 1 लाख पे हमारे पास 0.7 और 0.8 प्रोफेशनल है, एक भी नहीं है, एक कंप्लीट प्रोफेशनल भी नहीं है 1 लाख पे, एंड दे वांट 3 to 4 प्रोफेशनल्स पर 1 लाख पीपल आई थिंक। सो प्रोफेशनल्स लाइक रिद्धि, उनके लिए मजबूरी है कि उनको सोशल मीडिया पे आके कंटेंट बनाना पड़ता है, जबकि इट टेक्स हेल लॉट ऑफ अ टाइम, और बहुत वो भी मेंटल हेल्थ के लिए ख़राब है एक प्रोफेशनल की। अगर वो नहीं बनाना चाहते हैं और जस्ट टू रीच द पीपल, इफ़ दे आर मेकिंग द कंटेंट, इट्स सो सैड फॉर दैम। सो बेसिकली कनेक्टेड इज़ taking this responsibility too, so we are using our platform to give them the presence, the media visibility and the branding and all. So connected, why that's what I'm saying कि मैं इसे यूज़र के पर्सपेक्टिव से ही देख रही हूँ। मुझे कैसे पता चलेगा कौन मेरे लिए अच्छा है, तो मैं वही करने की कोशिश कर रही हूँ। थैंक यू।
Thank you, Ritu. I think one aspect which you really brought up here is, in mental space, it is more on the manpower dependent. Even though the, technology is used to showcase the presence and to also showcase the people who are really qualified to do this job, who are really professionals to do this job. So now from Ritu, I'll go to Riddhi. Since the wellness ecosystem is highly dependent on the human or manpower, skilled manpower, and we are highly deficient, whether it's a physical wellness or a mental wellness, it's a consistent challenge. How can it be replicated across location while maintaining, consistent quality and standards? How can we scale this?
So to answer this, I have to share. So while pandemic struck, I was in kitchen one day, evening, all of us, right? We were cooking, we were doing all chores of the house. And I was in kitchen cooking, and my child's friend came, and they were at the main door, and my kitchen is just adjacent to the main door. And this little one who was 8 that time, he said, I'm feeling very depressed. Now, being a mental health professional, my antennas went roll high. What is depression to an 8-year-old, and how is he talking about it? So I was just listening to the conversation, and he said, I'm feeling very depressed. So my child, being a little more aware, because his mother is a psychologist, a child psychologist, we have those conversations. So he said, kya ho gaya tumhe? He said, my mom didn't make vada pav today, and I'm feeling very depressed. 4 days I've been asking for vada pav. Okay? Now, right now, I'm also laughing on it, right? But we need to understand that when we were talking about scalability, when we're talking about how to increase the work in this, we need to have strict norms. We need to have processes. We need to have awareness. The words depression, autism, all these words are used so loosely, all right? In fact, I was at a college delivering a lecture, and while I was coming down from the 4th flight, I chose to walk down and not take a lift. So I was while walking down, there were few children, 4th standard, 5th standard mein rahenge, and they were telling each other, you look like an autistic child. I said, wow. So I just told him, look, wait, I need to explain to him what autistic child is and what is autism. And he said, no, auntie, thank you. So it means that there is no awareness about it. It's used as a label. It's used as fun, okay, which actually it shouldn't be. So there is more education needed, all right? Also, while we talk about scalability and all, we also need to understand that a psychologist who's working with adults, vice versa, a psychologist working with children are two different segments. I cannot address an adult. I cannot get a change in a 40-year-old being a child psychologist. But yes, I can surely get a lot of processes for the little ones, right? So what I am doing is I'm tying up with colleges, and I've signed MOUs with almost 6 colleges of Mumbai who has a psychology course, and I am taking personal interest to train. So get those students as interns, and I'm training them. Right? Like, what is child psychology? How do you create that? How do you work with children? I am doing a lot of SOPs, right, for new psychologists. I have done almost 16 to 17 cohorts, and now from April it will start again a new segment of cohorts for new psychologists and last year MS students, so that they understand what is practicing. Right? So there are a lot of things we need to streamline in this process while we even talk about scalability or making it reach to people. For psychologists, the basic, challenge before even we think about scaling is we are dealing with AI. We are competing with people who are not certified and not studied. Right? So we have courses of 1 month and you get certification of a child psychologist. Vice versa, I have spent almost 9-10 years studying psychology and therapy. Right? So I'm competing. So I need to get those things right first before even I think about, as an individual, as a system, about scalability.
Thank you. I think that's very relevant point. So aspect is one is definitely streamlining the processes, having an SOPs in place, and the other side we are trying to really compete with the people who are not even qualified and professional. So that's really interesting, because usually we have a tendency to compare on the basis of the professional fee, which is a wrong way. But anyways, from there I'll take a question to Dr. Vasundhara, to you. How do you ensure, even though the processes are being framed, like standard protocols are there, whether it's a clinical, administrative, everything is there, how do you ensure that the leadership alignment, culture and clinical governance remain consistent as the organization scaled up in various locations?
So one thing I'll say, that growth definitely puts culture on a stress test. Right? So that is a fact. Like you just mentioned, one way of alignment is having common processes which are tailored for the organization, but also freedom is given to the local units to customize it for the populations that they serve. So that is one way of aligning people with what we need. Secondly, because we have got the clinical outcomes, the financial outcomes, all outcomes relating to a hospital, administratively as well, are measured in a similar manner on a common dashboard. And all the leaders in the organization are part of a common forum when this is discussed. And they also contribute to any changes that we may need to make. So there is an alignment in that sense. And another thing which is very unique about the organization that I work with is that they actually invest in leadership training. And they also invest in ensuring that we have got capacity and capability built in the system. So when you're growing, when the DNA of the organization moves with these people into the particular units or the growth areas, it ensures that the alignment continues. So we talk about processes building reliability, culture builds consistency.
That's very interesting, very interesting. So, I mean, this is very important that, the process consistency is brought by the people. So, have to really invest in the people capability. So, Anushri, one aspect from this, which I have taken from Dr. Vasundhara, is also a data-driven decision, which was also helping them to align the leadership, this thing. So how do you measure impact and outcomes in a wellness business, and how does this this data, which is there in hospital setup very easily, how does this data is captured in the wellness industry?
So, just to bring Thank you so much, Doctor. But as I was hearing her, I just realized that everybody, when I came in, they're like, hospitals and wellness must be competition. And I realized that throughout this whole panel discussion, I was relating to everything she said, because honestly, we're not competition anymore, you know, we're actually complementing each other. And I feel irrespective, as I heard everybody on the panel discussion today, whether it's a psychologist, whether it's, you know, Birla bringing wellness to people or a hospital running, I think the focus is systems. It is data driven, you know. So even at a wellness space, we do have measurements, data, metrics that are taken, you know, even before you arrive, once you arrive, because you have to integrate with what's contemporary, you know. In a world of AI, we can't do away with it, but it has to enable us to make this system and this offering effective for people. So I think, like, you know, what already ma'am has said, but I want to just reiterate that it is purely metric driven. So the process could be whatever, but eventually the outcome has to be measurable. Otherwise, wellness also, like all these years, had been a storytelling game, which is why it never got structure, which is why it never got an industrial status. Because, you know, until now it was like you're feeling well, you feel good, right? Like labels had become big, but you didn't really know if you were depressed or not, because there was no metric to measure it. There was no test to tell us, you know, you have blood pressure or not, because if it is above a certain, you know, count, you have BP, high BP, if it's below. But how do you know depressed? If you smile 5 times a day, are you depressed or not? Or if you smile 15 times a day? There is no metric yet there are ways. So there are biological markers, there are certain functional regulators. So biological markers we all know, because you can go to a path lab and get a few tests done and you know, okay, you're going to be. There are certain things that are more functional, you know, how your gut feels, how are you sleeping. So even though we don't have a metric, we're able to rate them, that did I sleep better yesterday than today. Today we have a lot of tools. I can see some people, I wear a Whoop usually, but a Whoop, a Gabit, you have a lot of metrics telling us, okay, how has your sleep been? You know, so things that we did not know measurable until yesterday have become measurable today. And then there is mindful awareness to behavioral patterns. Are you eating regularly? Are you eating at the right times? So I think we bring consistency to all these 3 parameters, and that's how we report our data. And this data also helps in hand-holding of our seekers, who we don't call them patients. I think that's the only difference between, you know, what I heard and understood today, because we build a culture, we believe in systems, we believe in you know, bringing processes, and we believe in metrics that have to be measurable as well. And eventually what we do at a wellness place is that we ensure continuity by offering like memberships or certain continual programs, that even after you go, don't leave these habits. You know, these metrics allow you to stay on guard and make sure that anytime you drift away, you can come back and realign yourself.
Thank you.
Thank
I
you.
think that is really important, whether it's a wellness or a, you know, hospital industry. There are continuously some metrics which has been followed and where you can show the impact. So, and one thing which really Anushri has brought up here is whether it's a healthcare or whether it's a wellness or whether it's a mental well-being. We all are an ecosystem and we are working on the same parameter. So one last question which I'll be asking to you know, the panelists, anybody can pick up this. You know, what are the common threads, whether it's, you know, we talk about healthcare, whether we talk about physical wellness or mental wellness, give 3 important words through which this can make, you know, business of health and wellness scalable. 3 important words. Please.
So I think technology, clearly, because to scale you have to have, not only as an enabler, I think as a product, tech has to be the main interface. And it could be a hybrid model, that's fine, but I think it's the main interface.
Also a lot of research, you know, research-based awareness and research-based tools and techniques, especially in the field of psychology, is needed.
Thank Thank you.
And the one word I would say is we've been hearing about it. You don't know the impact unless you're able to measure it. And that measurement tool has to be a consistent tool. I can't say that I am doing well because I have a separate set of tools. So I think as an industry, we should try and get a commonality, because whatever you mentioned are actually pillars of health, whether it is physical health or mental health.
Very relevant point. Thank you.
When it comes to health and wellness sector, being a user, I will always look for the connection, the credibility, and the compassion. For me, it matters the most. For you, I can be a business. I can give you a business. For me, the connection and the compassion, the credibility for me matters the most.
Very important.
And I think this is what leads you to the masses.
Healthcare is incomplete without compassion. Thanks for bringing them.
Three words, but I think systemizing and processes. I think any industry has grown because of systems and processes, and especially representing the Indian ancient wisdom, we've had this asset forever. It was because of the lack of systemization, precision, we were not able to scale it. So it's an attempt, I think, when you start systemizing, which is why hospitals can grow, right, from 1 to 49, because you've got your systems, protocols, and processes in place. I think that's one uniform, irrespective of the industry
And
you
I
belong
think the
to.
one word that you use, culture.
So yeah, thank you for putting this forward. That's our, the key takeaways. These are the things, whether you're working in and whether a healthcare or a wellness, these are the words we should focus on. And thank you for this. Thank you for this wonderful discussion.